name is Joshua Geiger. I'm a family nurse practitioner student at Saginaw Valley. I'll be performing a head, ear, eyes, nose, throat, and oral assessment. Could I have your first and last name?
Wesley Bizzard.
Okay, hi Wesley. Before I introduce myself to Wesley, I would have, of course, knocked on the door. My hands are washed at this point in time. So, I'm going to ask some general questions. Do you have any pain in your head at all?
No.
Anything hurt you?
No.
Ever had any surgeries on your head?
Nope.
Headaches?
Nope.
Okay. So I'm kind of inspecting the quality of his hair right now. He's got a full head of hair. Just kind of looking at the skin on his face as well as the skin on his neck. I'm not noting any moles or blemishes. I'm not noting any scars, redness, or swelling, and no pain in your neck, correct?
Correct.
All right, so full head of hair, no baldness. The hair does not feel brittle. So I'm just gonna kind of palpate his head right now. I'm not feeling any bumps. I'm not feeling any indentations. No pain while I'm doing that, correct?
Nope.
And just kind of visualizing his skull, everything appears symmetrical. In talking to him, and then I would continue to further assess this as well. Everything's moving symmetrically on his face. I'm not seeing any involuntary movements at this point in time. And then kind of just looking through his hair, parting his hair in a couple different places. I'm not seeing any dandruff or anything like that. I'm not seeing any lice or nits. And then the skin, as well as I note, I didn't see any scars or anything. Skin looks to be of normal coloring. So right now I'm going to assess his temporal mandibular joint. So kind of pre-auricular on each side. And what I'm going to do is I'm just going to look at each side first. I'm not noting any erythema or swelling. So now I'm going to palpate each side. I'm going to say, can you open your mouth, Wes? Now close it. I'm not palpating any clicking sensation. I'm not hearing any clicking sensation. So now I'm going to kind of move down to his neck area. Looking at the front of his neck, trachea appears to be midline. Could you swallow for me? All right. And when he swallows, Adam's apple appears to rise symmetrically. It doesn't appear to deviate to one side. As I mentioned, trachea is midline. So then kind of looking at this Adam's apple area as well, I look for the thyroid when he swallows. So I would, of course, he just swallowed now. So now I'm going to have him kind of tip his head back and then swallow again. And once again, everything is rising symmetrically there as well. So what I'm going to have him do now is going to kind of have him scoot forward here. So that way I can kind of palpate thyroid a little bit more. So kind of pushing right here between the sternocleidomastoid and the thyroid, and kind of comparing sides here. It's feeling to me that there is an equal distance on each side. Not noting any swelling, no pain when I palpated there, correct? That's good. So I'm going to kind of have you kind of turn around a little bit, Wes, a little bit difficult with the couch here. So what I'm going to do now is I'm going to palpate your thyroid on each side and kind of deviate again. I'm going to be behind you. My hands are going to be around your neck a little bit. It might feel like I'm choking you, but that is not my intention for this. Okay?
Gotcha.
All right. So just kind of not pressing on each side at the same time because we are close to the carotids, but palpating, deviating, everything is moving freely there. And once again, I'm not noting any nodules, anything of that nature. While I'm back here as well, I'm going to kind of look at C-spine, kind of base of the neck here down, and I'm going to palpate there, pressing, no pain.
Nope.
How about sternocleidomastoid, trapezius area, any pain?
Nope.
All right, everything appears symmetrical there, not noting any lumps or contusions as well. So now we're going to have you do some neck range of motion. I'm going to have you put your head down to your chest. Now look up at the ceiling. Now look to your right, left, and then kind of like this, putting your ear to your shoulder on each side. Okay, and everything is appearing to move nicely as well there. Not noting any discomfort on part of the patient. So now we're going to palpate our lymph nodes. So what I'm going to do here, try to get a good camera angle. So pre-auricular, I'll go post-auricular, then occipital, kind of come back here to our submandibular, our parotid, our submental. I'm going to move down to our anterior chain, progressing back to our posterior chain. Now you shrug your shoulders up just a little bit, and then getting into our clavicular lymph nodes as well. So I'm not palpating any swelling of the lymph nodes. And once again, everything that I am palpating is moving freely as well, and no pain in part of the patient. Okay, so now what we're going to do is I'm going to move to our the ear portion. So I'm going to look at each outer aspect of the ear. It's looking, those auricles are intact. I'm not noting any blemishes, erythema, swelling. Not noting any drainage coming from the ear canal. So I'm going to palpate each aspect of the ear. So I'm going to kind of bend our auricle down on each side. They move freely. I'm going to palpate the mastoids behind the auricle, and then our tragus as well. And those are freely movable. No pain? Okay. So I'm going to actually, I won't have you turn for this one just because of the location. But what I'm going to have you do is I'm going to kind of have you press on your tragus here on one side and kind of hold it in. Okay. And then I'm going to see if you hear me rubbing my fingers.
Yes.
Okay. Then I'll have you do the same on the opposite side, kind of palpate that a couple times and then press it in.
Yep.
All right. So would you say that's about equal on each side? All right. Perfect. All right. So did our acuity test. Just glancing at this video quick to make sure I'm on track. All right. So then we're going to do our otoscopic exam. Get out. The key thing with this exam is going to be to protect the patient. That way we do not put the otoscope too far into his ear canal and cause discomfort. Okay, so what I'm going to do here is I'm going to use my pinky finger to kind of help brace myself against the patient, so once again I don't ram too far in to his ear canal. I'm going to grab the auricle, I'm going to pull up and back. And then as I'm inspecting inside the ear canal, once again looking at the canal, see if there is any sort of obstruction, if there's any drainage, any redness or swelling, which I'm not knowing to get on that side. And then I'm going to do this on the opposite side as well, but also looking at the tympanic membrane, noting the color of it. Hopefully it's a nice pearly gray, seeing if there's any scarring, if it looks like there's any fluid, any erythema in that aspect as well. So I'll progress to the other side here and flip my grip around. So I'm using my pinky finger once again to brace off the patient so as to not ram this into his ear canal. Grab the auricle, pull up and back. Once again, this ear, a nice pearly gray eardrum. Now I'm not noting any cerumen in either ear, so just earwax essentially. All right, and then there are a couple of special hearing tests that we could do as well. If need be, his hearing does appear to be intact bilaterally. I'm not noting any issues. We could do the Weber test. All right, hit our tuning fork, puts it in the center of his skull here. And then would you say you feel that sensation here, that on each side equally? Mm-hmm. Okay, perfect. So good, positive, negative beaver test, I should say. All right, and now we're going to move over to the nose, looking at the external surface of his nose. It appears symmetrical. I'm not noting any drainage. Have you ever had a broken nose or anything like that? Perfect. Just going to flip these around real quick. Okay, so now I'm going to kind of palpate his nose now, the bony prominence, as well as the lower portion. No pain, everything moves freely. So right now I'm going to also inspect his nares. I'll have you tip your head back a little bit. Each nair, I've been seeing the terminates, they're not reddened or swollen. I'm not noting any discharge or general swelling. The septum appears to be midline. So what I'm going to have you do now, just to assess for patency, press one there, breathe through it. Any issue there? All right, then we'll do the opposite side. All right, not noting any swelling, bleeding, or anything like that. So then there is a test we could do, transillumination of the sinuses. While I'm here, I'll palpate the frontal sinuses. No pain. All right, then the maxillary. Any pain? All right, no pain, and I'm not noting any swelling as well. So now we're gonna kind of move down to the lips right here. Not noting any cracking or anything, a nice kind of a pinkish red color. And they're both intact. I'm not seeing any scarring or anything like that. So now I'm gonna, for the oral inspection, I do have tongue depressors, and for an actual inspection I would use the tongue depressor, but I'm lacking gloves right now. And I think Wes would try to stick my hands in his mouth. So I will verbalize everything that we're gonna do here. So I'll have you open your mouth, and I'll have you say, ah. Okay, tongue is intact. I'll have you put your tongue side to side. Okay, so if I had gloves, I would use a 2x2, and I would kind of force out his tongue a little bit, and I would pull it to one side to the other side, and I would inspect the sides of it as well as the underside to see if there's any ulceration, aerations, patches, lesions, anything that just looks abnormal. And then kind of taking a look at his teeth. If his teeth are intact, not noting, just with my light here, any like dark spots that would indicate dental caries or anything like that. If I had a glove on too, I would also grab a hold of the teeth and kind of gently move them to see if they are mobile or if they're nice fixed and in place. So oral mucosa, nice pink mouth, not noting any ulceration, scarring, anything of that nature. And then when I'll have him open his mouth again, take a look at the hard palate, and I'll have you say ah again. All right, hard palate appears intact. And then looking back into his oropharynx as well, tonsils are not swollen. Soft palate, the uvula rises with phonation as well. Those are all good things. And I'm not noting any lesions on the tongue. So there we are there. And once again, I would do this quite a bit more in depth with gloves, but I don't want to grab Wes's tongue. And then I will note too, when I did the hearing test on him, I was testing cranial nerve number 8 as well. Okay, so now visual acuity, be kind of hard to show on the video, but we do have the Snellen chart printed, and I would stand 20 feet away with it. And then if do you wear contacts or glasses? If you did, I would have him put those on, but I would have him do the right eye, read down as far as he could go, do the left eye as far as he could go down on the Snellen chart, and then both eyes. and then we would document the scores and then the corresponding score together for that. All right, so now we're going to do our visual acuity, or not the visual acuity, but the visual field screening. So for what we're going to do there is I'm going to have you stare straight at me, and then what I'm going to do is I'm going to kind of put my hands on your side right here. I'm going to do them one at a time, slowly bring them forward, wiggling my fingers. When you can see my fingers wiggling, let me know. Okay, so all 6 fields there, all 6 quadrants, so to speak, he was able to see my hands wiggling. So then now what I'm going to do is test for the nasal defect. So then what I'm going to do there is I'm going to have him cover his right eye. And then I'm going to kind of just come across here, and when you can look straight ahead, but when you can see it with your left eye, let me know.
See.
All right, now I'll have you reverse eyes.
See.
Okay, so those appear equal as well. And do you have any issues with color blindness, color seeing? Okay, so then kind of just looking at his eyes right now, looking at his eyelids, eyelashes appears to be intact, doesn't look like they're missing or falling out. I'm not seeing any nodules or lesions, there's no redness, there's no swelling. And then just kind of visualizing the medial portion, there's a lacrimal duct. I'm not noting any drainage coming from that. And then the upper outer portion, the lateral portion, where the lacrimal apparatus should be on each side. I'm not noting any swelling or redness in that area either. So what I'll have you do, Wes, I'm going to have you kind of pull your lower eyelid down on the right eye, and just the conjunctiva nice and pink, not noting any redness, and then I'll have you kind of look, keep it down, and then kind of look either right or left. And the sclera, I'm not noting any extra vasculature, there are a few tiny veins here and there, but sclera is nice and white as it should be. So now I'll have you do the same on the left eye. Conjunctiva nice and pink, no redness, no drainage, and once again the sclera is a nice white color as well. So now what we're going to do, I'm going to take a look at cornea lenses. So I have my handy pen light right here, and I'm going to just kind of shine it in laterally on each side. Okay. And while I'm doing this right now, also I'm going to assess for the consensual and indirect reaction of pupils to light as well. So I would test each side twice. All right, and I'm going to have you look at the tip of this pen. Now look at the wall behind me. Okay, now focus on the pen as it comes into you. Okay, so now what I'm going to do is I'm going to have you test your cardinal fields of gaze. Keep your head still, but follow with your eyes. Okay, patient Wes is able to follow in all 6 cardinal fields. Pupils are perla, as I mentioned, I would say approximately 3 millimeter bilaterally. He's able to track. Patients have positive good corneal light reflex. Patient does have good convergence as well. And when I test all 6 cardinal fields, as mentioned, he's able to track in all directions also. So at this time, I have the room as dark as I can have it. But what I'm going to have you do now, Wes, is just kind of look at that wall behind me. And then right now I do have my ophthalmoscope ready. Just getting it set to 0 diopter. Check the ophthalmoscope real quick.